People need detox when they're physically dependent on the drug, and that's subject to a medical assessment. An easy way to tell is if you take medication and separate the time between your last dose and the dose when it's due, or if you wake up in the morning with symptoms like shakes or anxiety or sweats or nausea, chances are you're physically dependent and you need medically managed detox. Medically managed withdrawal is a necessary measure for people who are physically dependent on the drug. Drugs that cause physical dependence start with alcohol and sedative drugs like Valium and sleeping pills and Xanax. And certainly the opioid painkillers cause physical dependence. For people who have dependence, which means you cannot separate from the drug safely without monitoring, we prefer to keep people in an inpatient setting so that we can closely attune medication use to withdrawal symptoms. One thing I'll tell you that most patients ask is, how bad is it going to be? And my report is always, it's not going to be as bad as when you tried it on your own. We have an expert staff of nurses and other clinicians who will be with you through the process and use medications in decreasing doses to diminish the symptoms, which can be really quite awful. It's not going to be a cakewalk, but it's not going to be as bad as you think. We have a wonderful professional staff of physicians, a physician assistant, nurse practitioner, registered nurses, and medical assistants to manage the medical aspects of treatment. And counselors and clinical associates are available through the process just for supportive care. We've been doing this for over 11 years. I personally have been in the field for 37 years, and I would say that we've developed a very rigorous program to safely help people stop taking their medications. The environment is really pleasant and comfortable, the food is really good, and you will be cared for by an expert professional staff.